Does weight loss prior to conception improve pregnancy rates and birth outcomes for women with obesity and infertility? This is a question that has been asked and explored by many. Often, women grappling with obesity and infertility are advised to shed some weight before conception and undergoing infertility treatment. The rationale being this could potentially heighten pregnancy rates and enhance birth outcomes. However, this counsel has been largely based on observational studies, with a dire lack of confirmatory evidence from randomized trials. This gap in knowledge led to a comprehensive open-label, randomized controlled study known as FIT-PLESE. So, let's delve into this intriguing research to seek some answers. The FIT-PLESE study was carried out between July 2015 and July 2018, involving 379 women with obesity and unexplained infertility. These women were randomly divided into two preconception lifestyle modification groups. The first group, known as the intensive group, aimed to lose weight, targeting a 7% reduction. This was achieved through increased physical activity, meal replacements, and a medication called orlistat. The second group, aptly named the standard group, focused on increasing physical activity alone, without an explicit goal of weight loss. Both groups followed these lifestyle modifications for a period of 16 weeks, after which they received standardized empiric infertility treatment. This involved 3 cycles of ovarian stimulation and intrauterine insemination, a process where sperm is placed directly into a woman's uterus to facilitate fertilization. The primary outcome of this study was to assess the incidence of a healthy live birth. A healthy live birth was defined as a term infant of normal weight, without any major anomalies. To ensure a comprehensive understanding of the effects of the lifestyle modifications and infertility treatments, the researchers meticulously tracked the outcomes of any resulting pregnancies. Additionally, the study also paid attention to the participants who couldn't continue. Among the 191 women in the standard lifestyle group, 40 dropped out before conception, and among the 188 women in the intensive lifestyle group, 31 left the study before conception. However, all the randomized women were included in the intent-to-treat analysis for the primary outcome. The outcomes of any resulting pregnancy were tracked and included in the intent-to-treat analysis for the primary outcome of a healthy live birth. The results of the study were quite enlightening. In both the standard and intensive lifestyle groups, the incidence of healthy live births showed no significant differences. The numbers stood at roughly 15% for the standard group and around 12% for the intensive group. However, the intensive lifestyle group did experience significant weight loss, losing on average around 6.6% of their body weight. This was in stark contrast to the standard group, which saw a weight loss of just 0.3%. In terms of metabolic health, both groups saw improvements. However, the intensive group had a marked decrease in the incidence of the metabolic syndrome, reducing from 52.8% to 32.2%. It wasn't all positive for the intensive group though. They experienced significantly more gastrointestinal side effects. Plus, they also had a higher but not significant rate of first trimester pregnancy loss, with a rate of 33.3% compared to the standard group's 23.7%. These findings lead us to the conclusions of the study. The study concluded that a preconception intensive lifestyle intervention for weight loss did not improve fertility or birth outcomes compared to an exercise intervention without targeted weight loss. The results were quite clear. Despite significant weight loss and improvements in metabolic health in the intensive group, these changes did not translate into higher rates of healthy live births. This conclusion challenges the common advice given to women with obesity and infertility, suggesting that losing weight before conception might not be the silver bullet we once thought. It's a reminder that fertility is a complex matter, influenced by a myriad of factors beyond just weight and metabolic health. The study, however, has its limitations. The power of the study to detect rare complications was limited, and the design difficulty in finding an adequate time-matched control intervention was a significant challenge. These limitations offer opportunities for future research, refining the approach to better understand the relationship between weight loss, exercise, and fertility. This study also has implications for counseling. It suggests that advising weight loss as a primary strategy for improving fertility rates may need to be re-evaluated. Instead, a more holistic approach, considering a range of lifestyle factors, could be more effective. This study suggests that improvement in metabolic health may not necessarily translate into improved female fecundity. It's a reminder that there's always more to learn and understand when it comes to the complex issue of fertility.